In the United States in 2021, it's estimated that 281,000 women will be diagnosed with invasive breast cancer and almost 50,000 with non-invasive or in situ disease. That translates to about 1 in 8 women and 1 in 833 men. So the truth is we don't know what causes breast cancer. What I tell my patients is that one cell made a mistake and that mistake got replicated. And for some reason, in that specific instance, the immune system didn't take care of that abnormal cell and it let it grow and perpetuate. As much as people want to think there's one specific cause of breast cancer or that it's only related to family history, that's not really the case. And people get breast cancer for all different reasons, and it's many different diseases. The American Cancer Society and the American College of Radiology and the American Society of Clinical Oncology all believe that women should begin screening for breast cancer by mammograms at age 40 and yearly. There are some organizations that say that breast cancer screening should start at age 50 or should be every 2 years, but from a medical oncology perspective, we feel firm about age 40 and yearly. So it's a myth that breast cancer can entirely be prevented. There are things that we can do to reduce our risk for breast cancer, like avoiding smoking, decreasing alcohol intake, and losing weight. But even the healthiest patients are sometimes diagnosed with cancer. So it's hard to say that breast cancer can be prevented because in some instances, chance is what leads to cancer diagnoses. Treatment options for breast cancer depend on the specific type of breast cancer that a woman is or a man is diagnosed with. What I tell my patients is that breast cancer is more like 30 different diseases than it is 1 or even 3 diseases. Standard treatments for breast cancer include surgery, radiation, chemotherapy, hormonal therapy, and now even immunotherapy or targeted therapy. And a combination of those therapies may be used in any single patient depending on what the extent of the disease and what type of disease they present with. To prepare for breast cancer treatment, I tell my patients to focus on rest, maybe exercising, working on their emotional state, and getting their support system intact so that when they do start cancer treatment, however long that may or may not be, that they have everything in place and can just focus on their health. Certain types of treatment for breast cancer can affect fertility, like chemotherapy and hormonal therapy. So what I do is try to identify patients who desire future fertility up front and refer them to our oncofertility specialist so that they can discuss those needs and prepare in many different ways, including sometimes egg retrieval, IVF. There's fertility preservation for men even now. I do believe that men and women experience breast cancer differently. Unfortunately, I think there still may be some stigma in society about men having breast cancer as a diagnosis, and so therefore many men keep their diagnosis kind of under wraps and don't communicate it as freely with their family and their loved ones. I really encourage my male patients to share their diagnosis with their friends and family so they can get the adequate support that they need, just like any woman diagnosed would, and communicate with people so that they can learn more about the disease. Supporting friends and family that are diagnosed with breast cancer is really important, and really small gestures can go a long way. So I try to tell friends that things like asking a patient if they need a ride to their appointments, going with them to their doctor, asking if they can cook a meal and maybe make a meal train. Those things like that support patients in really grand ways that even larger gestures really don't, and they mean the world to my patient population.